Okay, well, Barbara Garcia, I really want to welcome everyone that's not from San Francisco. We're really honored to have all of you here. And those of you on the telephone, thank you so much for calling in. It's been an honor for myself personally, and also for the department to be one of the partners and allies to the Regional Pacific Islander Task Force. One of the things I have to acknowledge is that this has really been community effort from the Pacific Islander community themselves. And they approached me about the need of the Pacific Islander community in San Francisco. I've been really aware of this and have attempted to work with the local organizations. And that's really one of the issues here is the infrastructure for many of our community-based organizations is really strong and big. And for San Francisco, we have one organization. Although I do know from this effort, I've been approached by other community members and leaders who really want to see more 501c3s for this particular community. And so it was a great honor for me to sit and talk about how could we really support, and as you know, and I heard a lot of epidemiologists and data and folks, especially on the telephone. Health departments drive their issues and drive their direction by using data, but that's only one part of it. And I think that it's really looking at communities that have impact from health perspective that we all have known, and how do we really try to look at this data. And one of the things we really saw was in order to have that set enough of the data to really look at, although we know it by just looking internally in our own medical records, et cetera, by working with our communities, that really we have to do a regional approach to this, particularly as it reflects how the community lives and has been brought from their countries of origin into the communities. And as you know, San Francisco is a very, very expensive community, and we have a lot of people moving about in the region. And I think you could talk about this about homelessness, you could talk about this for other health issues and chronic diseases, particularly from African American communities, Latino communities who are really being pushed out of the cities to economics. So I was very honored to have, and really directed by our community members. And one of the roles that I play is I'm the director, but being a director, you get directed. And that's our job, being directed by community needs, being directed by community leaders. And I felt very proud to be directed in this aspect of really how do we look at the Pacific Islander community and their needs, and how do we do action around this. And so I really felt the real commitment to really look at this. And so we started. I was asked personally, could I reach out to some of the other health directors in the area, and I did that, and I got nothing but support about this issue and support, and also wanting to be involved in it. And so we've done a lot of work, a lot of planning, but I really want to just give it to our leadership, our co-chairs, Tao and Natalie, for really directing us and really showing us the way and giving us a path of how we should really do our work. Now, in the health departments, we all do planning, and then we all have recommendations. And now the job is, for me, is as we look at those recommendations, I don't want a plan sitting on a table. I want a plan that's alive and working and on. So that'll be our next phase of San Francisco. But I think from a regional perspective, I want to thank Alameda County and also San Mateo County, because we did all join together with a little funding, and I say a little funding, emphasis on the little, to really try to help with this process. So I'm going to stop there, but I do want to say that I'm very proud of our participation in this, and San Francisco is very committed to look at how to improve the health status of our Pacific Islander communities, and I will be directed as such, and I will do the job that I'm supposed to do for them. So I'll leave it to the leadership.
Wonderful. So we'll have a presentation and then a lot of discussion. So if somebody wants to join me here by the phone, we can launch the presentation.
We can.
you down.
Well, thank you, everyone. This is Tao, one of the co-chairs from the Pacific Islander Task Force, and we are truly, truly honored to be here. It's been a long way. We've been here since the early 50s or longer, but we finally made it to this table. And so, we are standing on some really, really strong soldiers of our ancestors who came before us. We have to acknowledge that. Also acknowledge those original people of the Native Americans who own this land. So we want to give those acknowledgments first and foremost. And so with that, we cannot begin to thank enough for Bar High for this wonderful opportunity, but also, really acknowledge Barbara and for saying yes to us and really just being there as a thought partner and also a champion along with the directors from the other two counties, Louise Rogers and also, Rebecca Gebhardt, who, and we also have Colleen Chawla, who is now coming on board. So with that, much thank you to all of you. So today we have a very busy agenda, and I know, as you all see with the objectives, is really learning about the task force and the work in the Bay Area. What have we done and how did we get here? Also a little bit of our history and background. You will hear a lot of that throughout, and we also have fresh off the press, and I hope those of you on the phone, you have the recommendation, have a little bit on there, but today we're just going to touch on who are Pacific Islander, doing some highlights, high level, information for all of you. And then again, we had only one ask to Bar High. How can we center our work regionally in bringing our data to disaggregate, because the federal government said so. There is mandates. There are also state laws that have passed. But we want to know, because we want to know how we can be started to disaggregate and standardize. And we want to be among friends and those who we want to, help you, help us. So that was the only ask, and that's why we're here. Who are Pacific Islanders? Next slide, for some of you on the phone. If you look at this, indigenous people, the original people from the regions of Polynesia, Micronesia, and Melanesia. Polynesians are Native Hawaiians, Samoans, Tongans, Tahitians. So just to give some, some example of what you're aware of. For Micronesian, we have folks from Guam, Chamorros. We have people from, the Federated States of Micronesia, Chuukese, the Republic of Marshall Islands, the Marshallese, and then also Republic of Palau. And then we have Melanesian. Some of you are familiar with the Fijian community, a huge population in Santa Rosa County, that area. So there, you will see we are spread out, throughout Northern California. And so that's what makes up the umbrella of Pacific Islander. So when we talk about Pacific Islander, there's like over 120 dialects in our community. And so there's a lot of subgroups, but the ones that you will hear most are those that are around here in the Bay Area: Samoan, Tongans, Fijian, Marshallese, Native Hawaiian, and Chamorros, and also some Marshallese. So you'll hear that. And then, so what is our affiliation with the United States? Next slide. There are 6 jurisdictions, affiliated states, and we all have affiliation. And to be specific, when we look at the top of that whole map, we have U.S. citizens. We have our U.S. territories, that is Guam, Northern Mariana Islands, Hawaii. Those are all U.S. citizens. The Compact of Freely Associated of Micronesia, these are called COFA migrants. These are compact impact agreements with the United States. And for your information, these are not immigrants, folks. They travel to and from their homeland freely. And so there's a lot of difference, and we have to, understand those rights. And what does that mean for Marshallese in Contra Costa, those areas, right? And then we have our U.S. nationals who are American Samoa. That is one of the territories. So they have just a right as the United States, U.S. citizens, but we just cannot vote for the U.S. president. So I don't know why that is, but and then we have our other Pacific Islanders, our Tongans, our immigrants. And you can see in that blue line there, that's our French Polynesia, the Cook Island, our Tokelau, New Caledonia Islands, and so forth, okay? So that's kind of giving you in the nutshell that although we're Pacific Islanders, we have different jurisdiction agreements with the United States, which hence it makes a huge difference when we talk about public health, right? And next slide. So the background, history, and the structure of the task force, right? One of the reasons why, as you see there's a lot of subgroups that makes up Pacific Islanders. And what we found is we cross county lines every time, when we're displaced from expensive housing. So there's also refurbishment that's for public housing. You'll see displacement on our community with gentrification. They're moving across county lines to live with their relatives. Very seldom you will see homeless Pacific Islanders, right? And then we think about, what about the, for care, access to care. There is a community health center in San Mateo, in East Palo Alto, Ravenswood. There's 7 nurses that look like us. Why do everybody cross the county line to go see them for prenatal care and for other care? Because they look like us and they help, and they do understand culturally. But that's not to say we have our own problems as a community. We're not utilizing our benefits enough. And why? It's because a lot of us, the service providers, can't find us. Why? Because we're all over the place. We're isolated. And that's hence the reason why we are here today, is that we want to look at this regionally. And so the task force was formed back in 2015. That is not that long ago, Barbara, but it seems like a long time, right? And one of the goals that we wanted to do was, when Barbara opened the door, we said, thank you, Barbara. We went back to the community and told them about the door that just opened for us. And what is it that we want the counties to know about us, right? Well, we want them to know what the challenges are. That's hence the recommendations and the priority area that you have with you, is that these are our problems. But we wanted to approach these challenges on the life cycle of how Pacific Islanders live. And that's why housing became the priority. It's because we want to provide safe haven for our community, for our children and family. The next would be maternal, child, and infant, and we'll go through that. But that's sort of like the cycle and how we represent ourselves. And that's when we went to Barbara and the directors. Here are priorities. And how we want to address the priorities, we would like to hear from the counties, what are you doing with the communities? And that was a really good interaction among the task force as well as the public health from the 3 counties. We learned a lot. Each learned a lot as well from within the counties. And so really the purpose of our task force is really to be the advisors to the public health, and also to serve as a go-to throughout the counties, as far as how do we work with your community, how do we improve, how do we reach out to them, and really the goal is really to really raise and educate our public health about the community. That's very important culturally, and what is considered cultural appropriate, right? And but that has been what we've been doing throughout these 5 meetings with the regional, and also work with them to really understand, learning to navigate the system from within. And that's what we did with each of these recommendations. We went and met folks like Curtis, and all the counterparts from different counties, because we want to learn what are the programs that are in the counties, so that way we can understand. And with that, we came and we responded with our recommendations because of that. how's my time? Okay. We have to talk fast here, so because the most important is Winston and our subcommittee. Okay, so there's our priority areas that you have in front of you. We have an infrastructure, so what we did was, because there's 2 co-chairs, it's a lot of work with 3 counties, right, guys? And so we thought, well, since this process works with me and Natalie, every priority would have 2 co-leads to lead those subcommittees. And each of those subcommittees we have 20 members of our task force from all 3 counties. And each of them will sign up based on what their knowledge base is of those priority areas. So some of them, like housing, Lafu works at Mercy Housing. She works within the public housing in Sunnydale. So we have people that can speak on that and have experience and who are also residents, in housing. We were able to, thank the directors that were able to make contact with the directors of housing, which is a non-public health. It is connected to public health, but outside of the county, realm. But we were very happy that they also came on board and speak to us. That's also part of what we're navigating is through that, okay? Okay. So remember when I said talk about we were looking at a lot of this through the life cycle, but social determinants of health framework is what we have here. So I'll turn it over to Sister Natalie.
So as you can see, this is a picture of a fale, and a fale, that is a Samoan name for a house. In Tongan, is it hale or fale?
Vale.
Also fale in Hawaii,
Hale.
They call it hale. But I will say fale because I'm Samoan and I don't want to, mess up any of my PI folks. So we thought that, if we are going to be working with our own community, we need to have something that when they look at, they can recognize as a model to move and a theory to move our work. And hence, that's, our fale. And after we came up with fale, we found out that in New Zealand, there is actually somebody actually came up with a model called Fono Fale, which means it's a meeting house. And we use this model, and we're still looking at it. We might change a couple of things. And it looks like, island life. There's a sun. There's the sun there. There's the clouds, and it kind of emulates what island life is. And for us to, move our community to healthier outcomes, we have to bring elements of our own community that they can latch onto and they can say, hey, that I can understand that and I want to move to that. So the life course model is the framework that we use. And as Tao mentioned, we strategically prioritize housing. And we all know housing is a basic need. We need it, and that is where a lot of you're being molded as a young person, and hopefully when you come out of your fale, and go into the world, the fale itself has stages around it. So from inside you are molded, you are cared for. As you move across the lifespan, and you get out of the fale, that you are well organized to be out in the world and move around comfortably. As comfortable as possible. And as we follow ourselves across the lifespan. And because we also understand there's an interplay of risk and protective factors that we encounter. So how do we organize ourselves in that fashion? We also have our priority areas. We recognize that maternal, child, and adolescent health is a very broad category, and we also understand that health also occurs outside of health itself. So we divided the maternal, child, adolescent health into 2 subcommittees: the maternal, child, infant health, and youth and adolescents. And our recommendations. All of our subcommittees worked on developing our recommendations, and these are the purposes of why we formed our recommendations, really just to help the county understand how do you help us and we were informed with this recommendations from the presentations that each of the counties presented on based on the priority areas we identified. Our priority areas were categorized in these ways. How do we have representation of Pacific Islanders in different spaces where we can, add to the conversation on how to help us, and funding, how to support us, through funding. And then also just giving each agency accountability and responsibility that you have the responsibility to serve the community and all people of community. That's public health. Data collection, that is, a big issue. We understand in our own work, in our own community, serving them, that we have a lot of issues. And then we come to the county and like, well, there's only 5 of you. Or, your numbers are not significant enough that it's not meaningful to even trying to generate or analyze anything. So that's, and then community needs, we want to really have the counties pay attention to the needs of the community. There's a saying in a lot of the writings of specific scholars, our islands are small and we're surrounded by the ocean. So we should be defined by the greatness of the ocean. And that's when we look at our issues, our issues are huge and we're very, very sick. But we're often, not visible enough to say, okay, let me give you $10 to go to see the doctor at Southeast. So, these are some of the milestones that we've met. We met the county 5 times. Barbara and her colleagues said, we're going to have 5 meetings and you come show up and tell us what you want us, what you want the counties to know about your community. We did that. We got seed money. Barbara was able to provide a coordinator to us, Ms. Mavis, who has moved on. And we've also went off and presented our work to a couple of conferences. This is where we are now, our phase 2. We're continuing to, look at our partners and our connections and how do we strengthen those. And also looking at how do we write regional objectives that across all of the 11 counties in the Bay Area, they can look at it and say, okay, we can work with that. Okay, so
right now we're going to pivot a little now to our recommendations, right? So what have you done lately with these recommendations? So we're going to quickly go through them. So I am going to be covering one of our subcommittee. They are working so hard that they are not able to be here. So that's what happens when you're a co-chair. You got to, wear all the different hats for all of us, all right? So what we've been doing for the housing, we were very fortunate and bless his heart, and Mayor Lee was really also one of the people that really helped, with the help of Barbara to say, hey, we have some initiatives. We really would like to see the Pacific Islander gets more involved, and we did. And so we also had the mayor's office, as part of the partners. And what that means is that there are 4 public housing in San Francisco that are undergoing renovation and everything. Unfortunately, each of those housing have different development organization building, refurbishing that. What that means, they each have, have to serve those communities. I don't know about you, but I don't know what development organizations that understand about community, not the fault of their own, but that's just the way, things are operating. But what happens is small communities and like Pacific Islanders get lost in that, right? Understanding what is our right. So there's 4 out of 7 that are undergoing that. And what's happening is some of our communities are undocumented, and they've been here. There's a lot of different issues, right? So they have asked the task force, can you help us out, and some of these things that we've been doing. So what we've been doing is not only in San Francisco, but also the other county, is really to assess the current state of where the housing is, affordable housing. Why are they leaving certain counties and whatnot? A lot of them are going to Contra Costa, Tracy, Antioch. There's a lot of our communities are heading out there. A lot of them are our church members too, so we know that for a fact. So how do we partner with all of you? Those are in the housing. HUD is changing constantly, how they outreach to the community. And then a lot of that has gone to these development companies as well. So a lot to navigate, but we're getting there. The development of these recommendations, it's a working document, because the more we understand the housing, the more we have to change a lot of our recommendations, how we work with them. And so there are also fundings that we come about, to learn within. So, for example, moving forward, there's funding like rapid response, right? Rapid response, we partner, we went in, and we apply for it because they go in phases. So whoever public houses, they have to displace all of the residents. So what do? Those that are left behind are undocumented. So we come in, we try to help them out. So we're working with San Francisco to try and find how can we help you help us. Okay, so that's been like moving forward. We're looking for those, and we're also reaching out to the community. So the committees are really trying to find their footing, because of 3 counties that we're working with, to try to figure out how do we improve the situation and where are the communities heading to. So the disseminating of the recommendations is what we want to do now with our communities and talk about the work that we're doing, hopefully just making sure that how do they get the information, right? And then just continually to work cross agencies, right, with other counties. So San Mateo have come and presented, also Alameda County as well. So those relationships we're still massaging and establishing and strengthening those, those relationships with the housing. And then more internal infrastructure that we're doing, right? So we definitely want our community who live in housing, public housing, to be a part of the team, because they have their ears to the ground. So that's kind of like how we're bringing our communities to get more involved with this. Okay. Our famous Milika. I want to turn it to Milika. She is one of our youngest, awesome champions that's overseeing our maternal, child, and infant.
Yes. Hello, good morning. My name is Malika. I work with the Alameda County Public Health Department. We're here to provide support to Pacific Islander pregnant women and children. I just wanted to go over our Pacific Islander Committee just because I'm one of the subcommittees. I couldn't be here today. She had to stay and work and cover somebody. But I wanted to go over the characteristics and data that in the Alameda County. And what we've seen is that Pacific Islanders are the fastest growing population in Alameda County, residing in Hayward, Oakland, and Fremont. We have the highest mortality rate we know, which is, those are the numbers right there, and then we have highest obesity rate. But we also do, however, have 200 births per year to Pacific Islander mothers in the Alameda County, which is actually higher than the Alameda County itself, which is 12.3. However, we do have the lowest in obtaining prenatal care in first trimester at 79.2, which is the lowest than Alameda County, which is 90.6. So what we have now at Alameda County, I think is the only Pacific Islander program, is we have Health Advances for Pacific Islanders, known as the HAPPY program, which I run. And what I do is I provide services and support to pregnant women, helping them find a clinic or linking them with insurance. We also give incentives, clothing, car seats, anything like that, and we just help them, support them through their pregnancy. The barriers that I've seen is that we have immigration statuses. They don't know if they need the papers or not, health insurance. They don't know where to find it or to go. Easy access location, maybe the clinics are very far away and they have to do transportation. And natural event, that is one of the biggest barriers that a lot of my clients have told me, is because they think that prenatal care isn't important. So it does bring with the lack of education, is that they don't know how important prenatal care is, just because back in the islands, we just go when we find out and we just go when we deliver. We don't go during the 9 months, because for easy access and location, the hospitals are really, really far to where we live. So the 9 months is not really something important to us. Another barrier is language. A lot of them don't speak fluent English, and It's really hard for them to communicate with the providers and all the health educators that we have. And then low level of comfort, they don't feel comfortable, and at their clinic's appointment, they don't want to go. And priorities is that we always see family as our number one priority. So if we are pregnant and somebody in our family is sick, we would tend to take care of them before ourselves. Wait, how do I work this? Okay, this is our fact sheet right here that I just explained. On the top right is mortality rate. We're high. We're all in the orange. The bottom left is birth rate. We're the highest in that. But in the first trimester into prenatal care, we are actually the lowest at 79.2. And yeah. So these are all our highlights. So with our program, we started actually 3 years ago with March of Dimes grant. So this is a grant-funded program. And just this year, we actually signed up for Measure A funds, which is a sales tax funds that provide services and support to low-income family and insurance families in Alameda County. So we actually got approved, and this program is going to extend for another 2 years. Hey. So now with this 2 years, we're going to try to work. Now we're happy. So now we're trying to work with funding and trying to get this, make it like a permanent position and program. And now we actually added a new services to this program for the Alameda County. Is we actually we are starting helping with enrollment to health insurance with the survivor families, which is you can bring your mom, dad, uncle, auntie, anybody, and for each application or insurance enrollment, we do give incentives as Target gift cards. Something to give to them just for coming and helping and coming out that shell to apply for health insurance. Our current efforts and next support is our next goal is to outreach to all of the 3 counties, the directors, outreach to the health centers and communities just to show them about our background and our cultural ways. Try to get more PI workers, just to comfort and to see familiar faces with everybody, and to strengthen partnerships with churches, because churches is our number one thing in our poly community, and I'm just strengthening them to provide the education that they need for the churches. Yeah, I hope I made that sweet and simple.
Thank you,
Yep.
dear.
Thank you.
Thank you, Melissa. So now we're pivoting to youth and adolescent health. Thank you, Natalie. So our 2 co-leads are Sarah Wonkin-Tanavasa and Christina Cole. They're not here. They provided these updates and highlights. We are continuing to develop and process and structure on how to serve and inform the county to work with youth and adolescent folks. And both of those ladies are professors at San Francisco State and College of San Mateo. And they are, they're trying to work across all 3 counties to serve our young people. And one of their goals is to make PI-specific data available and accessible for adolescent youth initiatives. One of our former members and co-lead of this subcommittee, Fa'unga Molinga, he recently, through the Oceanic Sunrise Initiative here in San Francisco, was able to advocate and pass a San Francisco Unified School District resolution to support our Pacific Islander kids in school. And that has actually passed. And the link there is to the resolution, the actual language. Is it going? And of course, data needs, Winston will cover that more. We need the disaggregation of data. We just need to see whether it's 5 or 2 or 5. We want to know rather than say, oh, it's not significant, we can't run it. We want to see it so that we can also understand, where are they and how do we help them? And then you have access to the data and programs and initiatives, and then also share that data information across the counties. And then sailing through, this is our behavioral health subcommittee. Jennifer Alva, she's not here, Lefa's here, but she's asked me to do this piece. So this subcommittee has moved a lot. There's been a lot of movements in the behavioral mental health subcommittee.
They've developed all of their recommendations for it and share the recommendations. Last year, we were able to hold a town hall in Alameda County in November. Rainy day, bad weather, bad parking. It was nighttime. 120 people showed up from the community. For them to hear about who was the task force and the mental health issues that that they experienced and we want to know about. We also were able to ask the County of Alameda, to have a proclamation for Mental Health Day, May 10th. San Francisco already has that in place, so to proclaim May 10th as Pacific API Mental Health Day. And also San Mateo County has also done the same proclamation. And in San Mateo also to hire a PI-specific employee, and I believe they did that. And then also develop API training for providers. We've also been very active in our voice, and in 2017, Alameda County released an RFP for prevention early intervention, and they grouped Filipinos and Pacific Islanders together in one RFP. Not that we have anything against our Filipino brothers and sisters, but we're like, no, we need to. That should be separated, and they had to re-release the RFP, and they separated the two communities. So that's a very that was a powerful action. And if we were not there, that's important. Like if we were not there, they would have went on in the RFP. And and then recently, RANS, the organization that I get my paycheck from, we were able to, we were awarded the Prevention Early Intervention grant in Alameda County, to do to serve specifically the Pacific Islander community, and our partnership RAMS and then the Task Force Taulama and the Samoan Community Development Center will be going across to serve our Pacific Islander community. And this is something that Jennifer and Lefa also wants me to share. We're looking at doing, the county is interested in doing a needs assessment across the 3 counties. And, these are just some of the items that's under that. And we can talk more about this when we have the discussion. And one last one, our population health, and that's me. So the highlights, we wrote out all of our recommendations and shared that with all the 3 counties. We are currently looking for feedback and input from our county counterparts and looking at key partners that are outside of the county and the government agencies. The development of understanding for collaborative opportunities that aligns across counties. And these are, follow-up meetings, to work with Tomas here on how do we fund some of our projects to do chronic disease. And this is the subcommittee, we look at chronic diseases, and this is still going across our lifespan. These are our older people in our community. And then just building internally to strengthen our internal structure. This is just a slide, and you can see this. This is just looking at Pacific Islander life expectancy in San Francisco. It's roughly 75 years, and 12 years less than Asians who have the highest life expectancy, and 8 years less than a typical San Franciscan. And that's from here in San Francisco data. All right, let me give it up to our main event.
We're here today.
Listen, thank you everyone for your food.
Okay, thank you. So next slide. Got it. Okay. So for us, the data subcommittee, from almost a year and a half ago, working with Mavis, we helped us organize the data subcommittee and thinking about some of the gaps or progress that has been made, and and I think about what's, moving forward, kind of thinking short-term and long-term, what are the strategies to really think about these things, data initiatives moving forward. And when we started, when Mavis helped us really pull together, we started speaking on the calls with some of the epidemiologists in the 3 counties, and kind of trying to understand what is currently the data that's being reported or that's available for Pacific Islanders, and also, what are some what are some of the potential opportunities where we can work together on. So those were kind of our first connections, and I also try to get some of my students at UC Berkeley School of Public Health, get them to join the data subcommittee, undergraduate and some master's students, moving from there. And just a quick data, kind of a nationally, there's 1.5 million Pacific Islanders roughly today, or 0.5%. They grew by 2.5 times from 2000 to 2015, so within a 15-year period. It grew really quickly, and California is the second largest state in terms of Pacific Islanders in the nation. Poverty rates really high, 17%. Uninsured rates also really high, 7.8%. And some of the largest groups, again, Hawaiians, Samoans, Guamanians, Tongans, Fijians were some of the largest groups according to the census. And then think about the leading causes of death. Besides heart disease and such, we also see up there unintentional injuries and assault, some of the social determinants. Why is that? And, something we need to really think about.
Can you go back one?
Yes.
What is the CLRD?
Chronic respiratory disease.
Yeah.
Yes. And then for the Baja region, account for about 1 in 4 Pacific Islanders in California. And I want to also briefly mention approximately half of Pacific Islanders identify as multiracial. So it's really important we look at data in terms of race alone, we're going to miss a lot of Pacific Islanders. So it's really important to really think about that when we're looking at the county level data. So this is data looking at more inclusive data instead of alone data. And we could see Alameda County, Santa Clara County, San Mateo, Contra Costa, all have populations higher than 10,000. I know we don't have the language data here, but thinking about threshold language populations, thinking at the county level, certainly that's a starting point to think about. And then just briefly, I wanted to mention there was some work that we looked at when we looked at all of the Medline PubMed data from 1809 till 2012. And typically today, PubMed comes out with 500,000 records or articles of publications a year. And then we looked at maybe 10 of the top health conditions in terms of publications, and also excluded non-human and also non-U.S. subjects. And then we use all the terms and also mesh terms based on the 2010 census for the race and ethnicity categories. And some of the trends, looking by decades, we could see, 76% of the publications thus far was based on the trends of the most recent decade, 2001 to 2010, and more to come. And if we estimate, just from 2001 to 2010, if we expect about 500,000 publications a year, 574 would account for roughly 0.01% of the publications. But you can see it's trending in the right direction dramatically. And then also defining the baseline by the conditions, we could see the publications that have the most hits, in this case, was cancer, followed by HIV/AIDS, diabetes, immunization, and the like. I think it's really important to, some of these means perhaps there's more money to do research and then publish on those, but it may not actually reflect the actual, leading causes of death and mortality and other things, social determinants. But just looking at these top 10 conditions, we could see roughly about 0.032% of the publications were Pacific Islander related publications. We look really carefully. So often there's many publications that say API. So we actually read the article to see it actually doesn't talk about PI. It's just all about Asians. So we took those out. So anyways, I think we're really lagging far behind Pacific Islanders. Pacific Islanders are 0.5 or 0.6% of the population today. We have far to catch up. And then just thinking back, where do we come from? Data for race or ethnicity. So looking at, on the graphic, we could see Hawaiians was first reported in the 1960 census. And part Hawaiian, that was the terminology back then. I don't want to go back earlier, but these were what we were considered racial categories back in the time. Even in 1890, we still see some of the mulatto, quadroon, kind of the challenges of how the government tracks race over time. And but I think it's really important to see that as Tao earlier said, coming in the mid-20th century to America, the Pacific Islanders, and kind of the data also, starting to reflect that here. And then just to continue, in the 1970s, Office of Management and Budget led a directive, OMB 15, that made a decision to aggregate all the Asians and the Pacific Islanders. So if you look at the data set, if you used to be racial categories are Japanese, Chinese, Filipino, Hawaiian. And then at some point in the 70s, they decided that's probably too many. So the government decided to integrate and put a catch-all Asian Pacific Islander category. So that was part of the OMB 15 directive. And that really kind of created some issues that led when the Heckler's report came out in 1950, Secretary of Health, Margaret Heckler, in terms of the Black and Minority Health Report, that it certainly identified the major gaps, for African Americans, for Latinos. But it said the APIs are the healthiest. So it really missed out if we're not looking at the data disaggregated on the Pacific Islanders in particular in this case. It really perpetuated a myth that Pacific Islanders are healthy, which compared to the other groups, which isn't true. But certainly, OMB 15 really updated in 1997, and certainly some of the grassroots work. I'm just remembering Hardy Spear and kind of some of the work, and others, really leading the work to really push for a need to separate Pacific Islanders from Asians back during that period. And that led to really, making us more visible out of the shadows. And also, post-Obamacare, ACA, really led to some of the new developments in terms of new Health and Human Services data standards. Really thankful for Ed Sondick at National Center for Health Statistics, really working with us and kind of thinking about the issues for the Pacific Islanders, data disaggregation, and also at the time under the Secretary of Health and Human Services, in particular Howard Koh, the Assistant Secretary, really led some of the efforts on Health and Human Services plan specific to Asian Americans, Native Hawaiians, and Pacific Islanders. So that was the first time that ever happened. So it was a momentous moment, really kind of bringing the issues of Pacific Islanders out of the shadows. I put a lot of links up there because they go to the original documents. And okay. And out of those original documents, we could clearly see in the HHS plan, there's 4 priority areas. The 4th priority is focusing on Pacific Islander health. And I'm not going to go through all of it, but I just have briefly mentioned, I know many of you are aware of the changes in California. Assemblymember Mike Ang's bill for data disaggregation and Assemblymember Bonsa's bill that led to California law section 8310.5 and 8310.7, which for Pacific Islanders specifically disaggregating for more Pacific Islander groups. Fijian, Guamanian, Native Hawaiian, Samoan, and Tongan. So those are some of the developments. And certainly, if we continue to aggregate Asians and Pacific Islanders, it's going to really neglect the Pacific Islander health issues. And it's really an honor and a pleasure to be working with the California Department of Public Health today. Office of Health Equity, Peter O. and Rafael Colone, and also earlier when Dolce Bustamante was still working with us and some of those efforts. And also recently hearing about the work with the Center for Health Statistics and Informatics and a number of other groups. So it's a really wonderful opportunity. I'm grateful for the health departments and the directors to really help us push forward and advocate for these efforts. CDPH has the data for all the counties, so is there a way we can work together for CDPH to kind of look at the local health department data for Pacific Islanders in a more efficient way as a partner? I'm not going to go into some of the data, but again, it's confirming some of the data by each of the counties. In this case, mothers living in the high poverty neighborhoods. Pacific Islanders have the highest proportions across the San Francisco, Alameda, San Mateo counties. And low birth weight, one of the highest proportion of low birth weight. At the same time, mothers were also the highest in terms of obese pregnancy weight and also excessive gestational weight. So why is that, And then certainly prenatal care first trimester. So maybe just a brief flow of data recommendations, really, if we could work on thinking with you how we could follow the new standards at the state and local level for data. Public-private partnerships are really crucial, and we look forward to thinking about that with you. And maybe some of the lowest hanging fruit. What are some things that's reporting that we can do today? Maybe it's just pulling data across years, or maybe adjusting for race and stratifying reports by racial groups for monitoring population health. Or, whenever Pacific Islander data is not available, don't just aggregate or put it with the other, but to indicate that it's not available. So, so I'll stop there.
Thank you.
Thank you.
So that ends our part of the
presentation. Thank you to the task force for a wonderful presentation and for being here. We really appreciate it and appreciate all the work that you are doing and on behalf of the PI community in the Bay Area.